except to hand over to Paul. Thank you very much, Paul.
Thank you, Stephen. Thank you very much indeed. It's good to be back in Southampton. I think this is my 7th visit now to Southampton. 3 public panels, I think twice before, maybe 6. And it's exciting to be back. Southampton is the Waterloo as far as fluoridation is concerned in the UK. And as Waterloo goes, so may the rest of the world. You never know. So you're in the eye of the storm, as it were. As Stephen pointed out, I've been working on this for 14 years, and the culmination of this is the production of this book here. And as I said to my wife, I said, it feels like being constipated for 14 years, and then someone's allowed you to go to the toilet. She said, for goodness sake, don't say that, because all they say is the book is a load of, you know. Anyway, I'm not sure if this is valid in the UK, but these are postcards produced by the publisher in Vermont, who's a very well-respected publisher, small but well-respected publisher, Chelsea Green. And if you use these cards, apparently you can get 25% off the price. Now, that's certainly true of the United States. I'm not sure if it's true in England, and you might find that your 25% off is more than exceeded by the postage. But anyway, I will pass these around anyway, so that if you want to play around with this, and if not, you can just give it away to somebody and tell them the book is coming out. The book is out in October. This is the first event around this book, by the way. You're number 1, numero uno. Okay, the outline of the book. It's in 6 parts. The ethical and general arguments against fluoridation, the evidence that fluoridation is ineffective, the great fluoridation gamble, the evidence of harm, Part 5, the margin of safety and precautionary principle discussions, and then at the end, the opposition, the other side, the promoters and their techniques of promotion or persuasion, however you would put it. The breaks will come after Part 2, and then the second break will come in here. And there's an exciting thing that's going to happen here. Each year, the Fluoride Action Network presents to a scientist who's demonstrated scientific integrity in this issue a plaque. And it just so happens that the scientist, one of the scientists who won it last year, is in the audience. But we've never been able to give this person the plaque yet, but we can do that this afternoon. So that should be exciting. So more questions then, and then we'll wrap up more or less with the public policy and politics of this issue. So ineffectiveness, health, and politics. All right. So starting with the part 1, which is the first 5 chapters. Chapter 1, it's a poor medical practice. No government has the right to force medication on its citizens, and that's exactly what's happening when you put a medicine in the drinking water. It's a violation of informed consent to medication, which is a pretty sacred principle for modern medicine. Fluoridation allows the government to do to everyone what an individual doctor can do to no one. An individual doctor could not force you to drink a glass of water containing fluoride. Could not do it. He'd have to tell you, he or she would have to tell you the side effects and the benefits, and you are supposed to choose. Government can't control the dose. This is key. They make a big thing, song and dance, about how tightly they control the concentration at the public waterworks. Whether they can or not, they don't always do it, a good job. But whether they do or not, what they cannot do is they cannot control the dose that people get. And it's the dose that's going to hurt you. So all the discussion about concentration is irrelevant. It's how much water people drink and how much fluoride they get from other sources. It's the total dose of fluoride that you get each day which is of concern. Government cannot control who gets it. Once you put it into the water, everybody gets it. Babies get it. Small children get it. Elderly people get it. Sick people get it. People with poor nutrition get it. Everybody gets it. No control. And ask a pharmacist about those two things. Go to a pharmacist and say, do you know of any drug which you can give to people without being able to control the dose? And do you know of a drug that can be given to everybody, regardless? Well, they say, absolutely no. Well, do you know that they're doing it every day in some parts of the world? 6, there is no individual oversight by a doctor. You know, everybody's different. So when you give somebody a medicine of some kind, the doctor is always prepared to hear about unexpected side effects. There's nobody doing that. There is no agency in the world which, as a matter of routine, is collecting evidence of any harm on this practice. It's outrageous. No agency is monitoring for side effects or accumulation in the body. When you know that 50% of all the fluoride that you take in each day, up to 50%, accumulates in your bones, wouldn't you think by now that some government that's promoting fluoridation or practices fluoridation would have got a massive amount of statistics of the fluoride levels of people in different communities, so you could compare with fluoridated and non-fluoridated. You could see what a difference lifelong, 10 years, 20 years, 30 years of living in a fluoridated community. No, not being done. Okay, so it's a poor medical practice because fluoride is not an essential nutrient. We don't need fluoride. You have perfectly good teeth without fluoride. And to demonstrate that something's a nutrient, by the way, you have to remove it from the animal's diet and show that the animal develops a disease. And if you do that with vitamin C, vitamin D, and all the many other minerals, you will get a disease if you deprive the animal of these things. But nobody has ever done that for fluoride. Fluoride's correct designation is a medicine. Why? Because its stated purpose is to reduce dental disease. Notice I've italicized disease, underlined disease. We are treating a disease. Or whether it's effective or not, that very designation makes it a medicine, not a nutrient, a medicine. It's a known toxic substance that interferes with many fundamental biochemical functions. In fact, the first opponents of fluoridation in the United States, active opponents, were in fact enzyme chemists, were biochemists who'd used fluoride in their experiments to do certain investigations. One of them included James Sumner, who won the Nobel Prize for enzyme chemistry. The level used in fluoridation is not small. They like to give you the impression that it's teeny weeny weeny. 1 part per million, they say, is 1 cent in $10,000. It is 1 inch in 16 miles. This is chemical and toxicological poppycock to try to persuade people on the basis of a smallness of a number without relating it to the toxicity of that substance. For example, 1 part per million is 1,000,000 times more than you would want to get of dioxin. It is also 100 times higher than the safe level for arsenic. So clearly the number of the concentration, whether it's large, small, or whatever, depends upon the actual substance that you're talking about. It indicates to me that those people who use that kind of nonsense know nothing about toxicology at all. And unfortunately, most of the promoters of fluoridation do not know anything about toxicology. Most of the promoters of fluoridation have dental credentials. It gives them the right to talk about teeth. It doesn't give them much knowledge to talk about the kidney, the lung, the liver, the heart, the brain, or any other system in the body. But is this 1 part per million small? No. It's up to 250 times the level in mother's milk, which means that a bottle-fed baby in a fluoridated community is getting up to 250 times more fluoride than a breastfed baby, and 250 times more than nature intended. So if you believe in fluoridation, you simply must believe that nature absolutely screwed up on what the baby needs in its first meal. And I, of course, do not think that nature screwed up at all. I think it's far more likely that the British Fluoridation Society, the British Dental Association, the British Medical Society, and the British government, the American Dental Association, I think it's far more likely that they have screwed up on this key issue.